Thanks for watching Afternoon Live. Seems like there's new information every day about the COVID-19 vaccination. Today, Dr. Ernst von Schwarz clarifies what is the most effective and the safest. We welcome back Dr. Ernst von Schwarz is with us today. Good to have you, Doctor.
Hi, Kara. Thanks for having me on.
Well, I really like these check-ins that we have because it does seem like there's always another vaccination coming in. You never know how you stand, even if you can get a vaccination, do get a vaccination. So this is great. Share what's new.
Well, the new thing in the last days was that the Johnson & Johnson vaccine, which is a single-shot adenovirus vaccine, in contrast to the messenger RNAs, has just received emergency use authorization by the FDA as of last weekend. So the company announced that before the end of this month, approximately 20 million doses will be distributed within the U.S., which is good for us because that particular vaccine does not need any ultra-cold freezers. We can even use that in our offices and vaccinate people in the office walking in. It can be stored basically in a refrigerator for weeks.
But I hear people comparing all these vaccinations, like, which one did you have? Am I going to get super sick? Because some people are getting sick after their second shot, and so they're wondering, was that Moderna, was that Pfizer? Should I get the Johnson & Johnson if I'm high risk because it doesn't have as high of what is it, 60% or whatever it is, you could tell me. But is there certain ones that you should be looking for if you are high risk to have? Or at this point, just get any vaccination you can get your hands on?
Well, as you heard several times, probably, the vaccines don't save lives, but the vaccination does. That means get any vaccine which you can get in your arm. Any vaccination is better than not having any vaccination. So at this point, there's really no head-to-head comparison between the different vaccine types we are using right now. Whatever you can get, you should get. The single shot might be more convenient for certain people, especially in rural areas. The messenger RNAs, there's some discussion now that if you had COVID and if you have developed some antibodies, that a single shot, even of the Pfizer-BioNTech and or the Moderna vaccine, might be enough. But at this point, still the recommendation is based on the clinical studies, and the CDC clearly recommends for the messenger RNA vaccines get 2 shots. For the J&J, Johnson & Johnson vaccine, 1 shot that has been studied worldwide, that's sufficient.
And then is it still wait the 2 weeks until you have the full efficacy as far as the Moderna and or I pronounced that wrong, I'm sure, and the Pfizer one? Is it still you have to wait those 2 weeks after the second shot?
Well, the study showed that within 28 days after the second shot, you have basically full protection, meaning you have the appropriate amount of humoral antibodies, killer cells, and other cells which support the immune system, which represents then basically appropriate immunization.
But you can still carry the virus.
That is heavily discussed, and yes, and the short answer is yes. Theoretically, you can still carry the virus, meaning you still can transmit the virus to other people. Even if I'm vaccinated and I have the virus, I could infect someone else close to me, theoretically. We know now that the vaccines definitely reduce somewhat the transmissibility, but they don't eliminate it completely.
So don't just say you can wipe your hands and be done once you have your vaccination. The mask's still critical.
I think so. And you heard what happened yesterday or in the last days in Texas and in 2 other states today, that people are talking about reducing the mask mandate or opening all business without any distancing. From a scientific point of view, we think that's way too early in the game and possibly dangerous. I mean, look at the numbers. I mean, for example, in California alone, we still had more than 3,300 new cases today of COVID-19. Wow. That's completely different than 2 months ago, where we had 50,000 and more cases per day. So the numbers go down, fortunately, but it's not over.
Right, we're headed in the right direction, but still a long way to go. Dr. Ernst, thank you so much.
Thank you, Kara, for having me.